Question 4, should children aged 5 years and older get the vaccine? Samir?
Yes, really important. And I think it's important to recognize that children have a much lower risk of severe outcomes with SARS-CoV-2. And people, it's always about a risk-benefit calculus. And I think one of the problems, a little bit of misinformation that's out there is that it's only looking at one side of the equation. And that is that when everything is about balance, we talked about before. And so people are more worried about the vaccine than they are about COVID disease. And what we need to recognize is that even though it's low risk, it's not zero risk. A lot of kids have gotten this virus, and some of those kids have gotten sick. Some of those kids have died. Over 1,500 kids have died in the US. In Canada, we've done better, even proportionally. I think less than 40 kids have died, but that's still, 37 kids in Canada who have lost their lives to this virus. 6,000 kids were hospitalized for this virus in Canada, over 600 in the ICU. Kids can get sick. Kids can get specifically something called multisystem inflammatory syndrome, which is an inflammation of several different organs. You heard about it earlier in the pandemic. It could be very devastating. When you compare those risks, which are still relatively small, to the risk of the vaccine, again, the risk of the vaccine remains much lower in kids. And so that's where you have this risk benefit. And people talk about myocarditis, which is a risk in young adults, older teens, but the risk of myocarditis from COVID disease is many-fold higher than the risk of myocarditis in the vaccine. So it's always about that risk benefit and understanding what's on the other side of that ledger, which is the risk of COVID, which many, many children are getting, particularly now that we're back in school, particularly now that masks are not mandated in schools. Many children are getting this. Also, we've talked a little bit about long COVID. Kids can also get long COVID. Kids can get mild disease, but still have long-term symptoms from this virus. It can be very challenging for many, many children. We think it happens less than it happens in adults, but it still happens to a fair proportion of children. And if that's your child, your child is suffering. Your family is suffering through that, whether they get sick or whether they don't get sick, but then get long-term symptoms. So that's why in the balance of things, if you look at the risk-benefit ratio, it's clear that the benefit is in vaccinating children. And that's to say nothing about the impact on children being vectors. Children, even if they're only mildly symptomatic, being able to spread it to their teachers, to their parents, to their grandparents, to people who might be in their circle who are immunocompromised, and then perpetuating the pandemic in that way. So really important for us to be able to vaccinate kids from all of those points of view, to protect them, but also to protect from forward spread.
That's
that, if I might add, just as Samir and I, being parents of young kids ourselves, the other thing is that you have to think about in kids is, loss of school and time away, if they get like the other effects that COVID can have, if they do come down with the COVID virus and are ill from it. So those can have, pretty profound mental health and other impacts on their education as well, for loss of school and time away from their peers and social interactions.
And I will say that all Anju's kids and my kid are fully vaccinated. So we practice what we preach. Yeah.